I want to say welcome and thank you for joining us. Just to give you a little bit of background, this webinar came about in response to a SuSanA workshop held in Zambia in June, where we were trying to understand more what SuSanA can do to support country-level programs. And Jonathan's just shown up. He actually facilitated the workshop. Hi, Jonathan. And in particular, we asked what local government and NGOs in Zambia would like most support with. And one of those that was identified was community engagement, especially for urban sanitation in Lusaka. So this workshop is, well, this webinar came about after that workshop so that we could help the local actors there with some resources to be better able to understand what tools can and can't do for community engagement, the questions they should be asking each other and the processes that they can go through to select the right tool. So for that reason, we've got Pippa Scott just giving an overview on urban sanitation, where we are and where we're going within the sector. And Pippa is an urban sanitation specialist who's affiliated with the ISan group, which stands for Integrated Sanitation Solutions for Urban Development. And her work spans technical, advisory, primary research, knowledge management activities. And she's been doing this for over 10 years. Then we're going to look at two different community engagement models. We're going to look at the clues model, which Sam from Sandec is going to give us an overview of. There is a YouTube video that I will share the link of about this, which you can watch at another time. And Sam works for AVAG, and he's worked on clues in India and I hope in Zambia a little bit as well. Then we're going to look at the U-CLTS model, which Jamie's presenting. And Jamie works with the CLTS Knowledge Hub at IDS, and they're about to release the new U-CLTS guidebook or handbook about implementing this in urban situations. And then finally, Marta's going to finish up for us. She's been doing her PhD through the CTAB lab, and she's been looking at appropriate technologies and management of sanitation for water and solid waste. And she looked at planning tools for her PhD and compared two. So she's going to share some of her experience of comparing tools and hopefully give people some useful inputs for doing that. So that's the brief overview. I'm now going to hand over to Pippa, and I will let her take the lead with giving an overview of urban sanitation, where we are and where we're going.
Thank you, Esther, and thanks for having me here today. I'm going to present a paper that I presented at the WEDEC conference in July this year. So thank you. So just to say, yeah, this is a presentation about urban sanitation and where we're going next. It's a paper I did with Rebecca Scott and Andy Cotton, both at WEDEC, which was basically in a way to try and kind of see where we're going to go forward with urban sanitation, that we actually started taking a kind of historical view and looking back. Just make it a touch smaller so we can see. So basically looking at the timeline, we started in 1980 basically because before then there wasn't much. Urban sanitation didn't feature too heavily on international development sphere. And 1980 to 1990 was the international drinking water supply and sanitation decade. And in that decade itself, there was quite a drastic shift in terms of development thinking overall. And a lot of development thinking changed from the kind of top-down technocratic approach to development to a much more bottom-up, grassroots approach to development. Robert Chambers, who many of you know, was hugely instrumental in this, and he talks about putting people at the center of development, and some of his iconic kind of writing on putting the last first and whose reality counts kind of really sits within those frameworks. One of the big learnings that came out of the decade of water supply and sanitation was the centrality of demand. Prior to that decade, we didn't really talk about demand in sanitation programming. And that's kind of what led into this drive towards demand-led sanitation and understanding the kind of pull aspect of sanitation. And slowly this kind of approach of putting people at the center and understanding that this demand aspect filtered down into these planning conceptual frameworks that exist now in sanitation. So we've got the strategic sanitation approach, household-centered environmental sanitation, which has now kind of become the CLUES model, which we'll look at, Sanitation 21, and while they may look different, many of them are kind of underpinned by the same logic, which is kind of putting people at the center and understanding the city around them. Also, kind of what happened towards the end of the 1990s was on-plot sanitation started to become recognized as a potentially a viable solution for the immediate and mid-term kind of time frame for urban areas. Prior to this, it wasn't really kind of recognized as an acceptable solution. It was kind of urban areas were de facto sewered. And one kind of landmark study for me, which was this kind of cross-sectorial Calcutta Slum Improvement Program. And one of the kind of main findings out of that was what slum residents were prioritizing wasn't kind of specific linear improvements in their kind of basic services. What they prioritized was the change in their lives, the kind of the impact that the whole kind of intervention had across their lives. So they wanted cleaner streets and lighter streets, but not necessarily kind of toilets, drainage, solid waste management. So then moving into the kind of 2000s, a lot more work was done around understanding this kind of the concept of demand, so understanding why people wanted sanitation, perceptions. We started understanding this kind of network, this incredible network of small-scale providers that were actually the ones who were offering sanitation services and products in cities. And the literature and the kind of general talking in sanitation starts talking about unlocking the nature, applying sanitation marketing principles to unlock this latent nature of sanitation demand. And we started to understand why people want toilets and why they might not be able to access them. And it wasn't until 2008 that this kind of the linear model that we know today of containment, emptying, transport, treatments, that I think many of us who work in urban sanitation use, that became kind of normal and kind of generally accepted as the kind of the framework and the way that we consider urban sanitation. But as we kind of got to 2008, which was declared the International Year of Sanitation, essentially in recognition of the huge crisis point that sanitation was at, was that there were still huge questions around what we do when the pits fill up. How do we empty them? What do we do with the waste that we empty? The issues of demand, although we kind of got some headway in terms of understanding it and understanding that it was important, it wasn't necessarily as simple as I think we'd hoped in the early 2000s. There seemed to be a lot of tenure issues that were tripping up a lot of kind of infrastructure, slum improvement and sanitation projects. And I think there was a kind of general feeling in 2008 that we just didn't know how to do urban sanitation. It was a big, scary problem in 2008, which is kind of one of the impetuses behind declaring 2008 the year of sanitation. So now looking kind of over the last decade, kind of where we are in comparison to 2008, there's been a huge amount of work that has really kind of built up behind looking at different pit emptying technologies, where they might be appropriate, how they might be developed. There's some work that's gone around the tenure. We've got a better nuanced understanding of shared sanitation. We've got a better understanding of sanitation business models. If some can make money, maybe they can't. But kind of we've got a much more nuanced understanding of all of those. And we're kind of starting to dig a bit more into kind of co-financing around sanitation. And then on the conceptual side, we've also come a long way in terms of CLUES as kind of embrace this idea of the enabling environment, which was inherent in the earlier models, but has really kind of pulled it to the fore, which I think we'll get into in that presentation. And then we've got also more tools and kind of techniques in our bag, like the SFDs, which also inherently bring in the concept of enabling environments to help us understand what's going on with the SFDs behind it, and also the sanitation safety plans, which again are concepts to help us understand what's going on in the city and how we might address it. So just to take a kind of overview, where we are today in terms of urban sanitation is we've got a much deeper understanding of the value chain of sanitation. We know what happens beyond the toilet, and we've got kind of different tools and techniques of understanding and mapping and measuring what's going on. We've got a much better understanding of sanitation as a business, and better ways of generating demand for sanitation services and businesses. There's an absolute appreciation of the need for an enabling environment, a positive enabling environment, and that helps us understand why things are the way they are in different contexts. And this kind of linear model of containment, emptying, transport, treatment, reuse has become the kind of de facto model that we've been using for urban sanitation. So that's where we've got to. And what we were doing with this paper was we started to try and understand what's missing, what have we lost. And one of the things that came out was very much people that in the kind of 1980s, 1990s, that we were kind of saying are central to developments seem to be missing from our current kind of way that we're approaching sanitation, and that the centrality of the demand isn't necessarily featuring as heavily as it was, and as heavily as it was in the early kind of planning frameworks. Another thing that's missing is these, I'm not quite sure what's going on there. Someone else moving the presentation? Another thing that's missing is very much the kind of complexities of the urban environment, and not just the urban sanitation environment, but the urban environment. Again, it's not necessarily represented in the way that we're conceiving urban sanitation. And what this means is that the kind of complex human environment technology systems that are happening, that are present in all cities, aren't necessarily taken into account, and equally that sanitation can't proceed in isolation of drainage, solid waste management, and water supply. And then just picking back up on this point from the Calcutta slum upgrading study, sanitation is important, but so are many other basic services. It might not be the number one priority of residents, and it might not be the number one priority of key decision makers like a city mayor. So in terms of where we go from here, where we were, our suggestion with this paper was we've done a lot of work. We've kind of jumped into a rabbit hole of urban sanitation and fecal sludge management, and it's time to take that knowledge and to come back out of it and to try and integrate these concepts and these huge advances that we've made in understanding what's going on into the kind of bigger, more complex environments of the cities and the earlier planning kind of frameworks, and start recognizing that sanitation is a system within other systems of the city, and to consider it in kind of parallel to other systems in a kind of integrated service provision framework. And it's about putting sanitation back into these wider kind of more complex systems that are happening within a city. And just to conclude, and I think an important point for this this group is that often these kind of frameworks and tools and everything that's out there are often kind of put in competition or seen in competition with each other. And my perspective on them is that they're complementary and that they can work together, and it's about understanding how they can kind of sit with each other and which parts of the puzzle they're helping us to solve, and which parts of the puzzle they might help key decision makers work with and solve. So I think I'm going to stop there. I don't know if we're taking questions now or at the end, Esther.
Yes. Hi. So we can take a couple of questions. If anyone wants to stick their hand up, in the top left next to your microphone and webcam is a person. You can either put your hand up or you can type in the chat box below. But I'm hoping that as we see the progression of each presentation, there'll be some natural discussion coming from this, because I was actually just making notes. But I think what Pippa's saying about tools being complementary and helping with different parts of the puzzle is really important, because a lot of people invest a lot of time and effort into these tools, and it's almost like having children. It becomes your baby, and it's quite it's quite an output. And I think sometimes we get a little bit territorial over these things because we've invested so much in them, when actually, if we take a step back and look at it from a decision maker's point of view, actually what they want is not you coming in saying, I've got the perfect solution, is saying, you know what, let's focus on, I can help you with this little bit, but there might be something else that's better designed. And that was the idea by having Marta at the end, is to look at these questions we should be asking ourselves, and how best to do that. So yes, Selma, are you typing a question? Because you've got a webcam, so if you wanted to just turn your camera on and whack your mic on, you could ask it yourself. But if there's... hi Selma, do you have a question for Pippa at all? 1 second, let's just make sure your mic is on. There we go. Yeah, your mic's on now. And I still can't hear you. Have you... turn the microphone on in the top left, is it green? Okay. Oh dear. This is the downside when technology doesn't work. It's so nice though when it does. Yes, Pippa?
No, I was trying to point where the microphone was.
Yeah, it is just... no, that's... Oh, this is where I get confused because it's all in reverse. She's just typing the question. Oh, just thanking Pippa. Cool. Thank you, Selma. Okay. What we'll do is we'll carry on to the next presentation, which is Sam, who is going to give us an overview of the clues model. And as I have said, he's got a very nice video. I'm just going to put the link in the bottom. But in the meantime, Sam, are you able to wing it without the video? Let me just put... Yeah, your mic is on. Can you... Yeah?
Okay. Hello, everyone. Do you hear me?
Yes. Go on.
Yes. Yeah, so Esther asked me to prepare a presentation on clues for this webinar, and as I am very lazy, and also because I thought we already have a really great presentation on this, I don't need to do this, so I thought we could watch the YouTube video. It's basically a lecture from our massive open online course. So I don't know how we want to do this. Do you want to all go to YouTube now and watch it, or is everybody familiar with the clues approach? How should we go about this?
Maybe if you can give us a 2-minute overview, and then people can go and watch the YouTube video at some point afterwards or before. Because, yeah, I think maximise on the online time, if you can.
Well, then I'm
throwing you in at
gonna,
the end.
yes, that's okay. So CLUES is basically, it stands for Community-Led Urban Environmental Sanitation, and it's basically a planning approach consisting of 7 steps, where the community is in the core of the planning approach. So, as it says in the title, community-led. So it's, I think, very similar to many of the other planning approaches, where it starts with ignition. There are workshops involving the community. There are expert workshops where different sanitation systems are discussed. There's an assessment phase before that. And in the end, the goal is to come up with the most suitable sanitation solution for each individual context. So CLUES is not a tool, but more of a planning framework, consisting then of many different tools for the different steps of the approach. So also important to notice is that it should go beyond the user interface. So we're not only talking about toilet and collection systems, but the idea is really then to cover the complete sanitation service chain, and also the asking the question of what is already implemented, what services do exist, what informal or formal systems are already there. So this also plays into it. And what's the difference maybe from an urban approach to a rural approach is that here really the heterogeneity of urban communities is acknowledged and is tried to be taken into account in this planning framework. Yes, so we tested this mainly in Nepal, India, Tanzania, and to some extent in Zambia. So in Zambia it didn't go beyond the ignition phase, and then it was not taken up by the stakeholders anymore. So we could also talk about why something like this can fail. So maybe I would suggest that after this really quick overview, I would give the word back to the crowd and see if there are questions or if there are points to discuss at this moment.
I'm just trying to upload a copy of the clues guidelines for you, but in the meantime, Jonathan has raised his hand. So, Jonathan, go ahead.
Hello, everybody. Can you hear me okay?
Yes.
Great. My question, Samuel, is the community-led urban environmental sanitation approach needs to sometimes link to municipal systems to be successful, and I was just wanted to hear from you about your experiences of engaging with local authorities and utilities, starting with the community-led approach. I know this was the focus of the Sanitation 21 update, was to try and make those connections between the municipal planning processes and the community-led processes. I was just wanting to hear about whether, based on your experiences in Nepal and other countries, whether that had been successful or not. Thanks.
Yes, thank you, Jonathan. Yeah, I think you raised a very important and good point here. I mean, CLUES is called community-led, but I would say that in reality, or in the case studies that we did, the community plays a very important role, but it never goes without the local authorities or without the utilities. So maybe not all of the examples that we did were in fact community-led, but I would say that the community always played a really important role. So I think the question that we have to ask ourselves with all of sanitation planning is, to what degree should different stakeholders be involved at different stages of the planning process, rather than who should be in the driving seat throughout the process. I think the community can play a really important role when it comes to, of course, demand creation, when it comes to maybe assessment, but then when it comes to implementation, I think other stakeholders are much more needed than maybe the community. Yeah, does that answer your question, Jonathan?
Oh, Jonathan, your mic's off. Let me just...
Yeah, thank you so much.
I actually think that for me, in the past, one of the scary things about community engagement is how, because community is such a big, scary word. And I think kind of some of what you were saying about breaking it down, I'm quite a techie person. I like a simple, straight, linear thing. And as soon as you involve the community, it all goes a bit haywire. So I think some of what you're saying about community engagement and just how to do it, sometimes it's just giving people ideas as to how to engage and the direction to take things in. We're just uploading for you, on the left here, the community-led, the CLUES planning tool. So you can see here, and I've put the link in the chat box if anyone's interested. But yeah, I don't know if there's anything specific, Sam, that you'd like to highlight from this at all. But you can now at least see so it's 7 steps here that you can follow, and hopefully it will solve all your community engagement well, some of them, at least take you in the right direction. Sam, is there anything else you wanted to add on that? Now you've got a visual.
Yes, thank you, Esther. Yeah, maybe two things to add are the different parts of this guidelines. So first is the planning steps, the things you do in order to come to an action plan in the end that can be implemented. And the other two parts in this document is the enabling environment and how to assess this. So what are the things that need to be in place around the community, around the technology, in order for a sanitation system to function. And then part 3, the toolbox. So this acknowledges that for each different step of sanitation planning, there might be different tools that are needed. And this toolbox that we present in the cruise, we don't think by no means that this is complete or that this is all there is for sanitation planning. Also, this document is, again, a couple of years old. So there in the toolbox, this should be a lively part or something that can be developed. So again, for each step of sanitation planning, for each different task, there are many different tools that are very good out there. So you shouldn't focus on just one planning approach or one tool, but rather try to find the best solution for each problem that you have. So back to you, Esther.
Yeah. Okay, great. Any more questions for Sam at all around clues? I've got mine. Yes, Laura, it is being recorded, and I will put the link up in the forum discussion. Okay, if there's no more questions, we will move on to Jamie, who is going to be talking about U-CLTS, which, yeah, I'm quite interested to hear more about because I understand that it's been quite extensively tested, and now they're at the stage where they can share in a bit more depth some more updated handbooks and guidelines. But I will hand it over to Jamie. All yours.
Thank you very much. Can people hear me okay?
Yes.
Great. So I just wanted to begin with a quick disclaimer for those who are familiar with community-led total sanitation. So what we're suggesting with urban CLTS is not a copy and paste of rural practice or even a copy and paste from one urban environment to another. But we see it as a set of principles that are used to design and implement urban sanitation improvements. Subsequently, it will be highly context dependent, and what this looks like on the ground will look very different from case to case. I'm going to begin by giving you a brief overview of what we see as the principles, then go through the relevance of an urban CLTS approach across different urban typologies, and then give a brief overview of 4 different overarching phases. So the defining principles of urban CLTS are, okay, so the first one is participation and empowerment. Community members are at the heart of the process and drive the agenda, taking a central role in advocacy and decision making. They're supported to take actions where possible and catalyze advocacy efforts to solve their sanitation challenges and work with others to achieve their rights for services. There's collective behavior change and collective action, which requires the process to focus on all. Everyone must change unsafe sanitation practices in order for the risk of future contamination to be reduced. There's community ownership. A community-led process cannot respond to all the sanitation and hygiene needs across the sanitation chain, as we've already discussed. And ownership can come about directly through communities taking their own actions, but can also be built symbolically through community participation in decision-making processes, along with other stakeholders. There's demand creation through triggering. Triggering is a set of tools that evoke powerful emotions, usually discussed, to confront the negative impacts of open defecation, bad fecal sludge management, and poor sanitation on the entire community. And the aim is to get institutional and community-level agreements and action, recognizing that by working together, the quality of sanitation can be improved. And ultimately, there's natural leaders. who are community-based agents of change or champions that should emerge throughout the process and can lead and support subsequent activities. And then finally, there's total sanitation. It's not considered successful unless everyone is using appropriate safely managed sanitation facilities sustained over time. The aim is a ship-free local and broader environment rather than just an open defecation-free community, requiring attention to adequate provision, maintenance facilities, and treatment waste services. So we have seen examples from Egypt, Eritrea, Ethiopia, Ghana, India, Indonesia, Kenya, Madagascar, Mauritania, Mozambique, Nepal, Nigeria, Tanzania, Uganda, and Zambia, just to give you an overview. And then, so now I just want to have a look at where it is appropriate, and to highlight this table. Urban CLTS has been applied differently across the spectrum from rural to urban, from small rural towns on the left-hand side of the table to densely populated slums. This table is a very simplified breakdown of what we see as relevant urban typologies, focusing on characteristics, the potential sanitation challenges, and examples of where an urban CLTS approach has been used. As we move from peri-urban areas to informal neighbourhoods and large cities, we see the complexity of the challenges increase. And just to point out, I show you this not to highlight that an urban CLTS approach can and should be used everywhere. There are definitely favourable conditions and more challenging environments, but it does have the potential to contribute to improving sanitation and hygiene practices across the urban spectrum. In peri-urban areas and smaller rural towns, an approach closer to the rural methodology is used, and the denser and more challenging the urban environment gets, the more adaptations that will be needed, and any community-led intervention will need to be integrated into a more larger, complex puzzle. However, saying that a more complex and messy environment does not mean the thinking, tools, and tactics are irrelevant, just that need to be better integrated into wider programs. So, as I mentioned earlier, urban CLTS is not a unified concept and means a huge spectrum of things. We are deliberately avoiding giving universal advice focusing on specific and rigid step-by-step actions. Instead, we are recommending 4 overarching phases. Number 1 is assessment and preparation, which involves collecting relevant information that will then support the process. This includes a situational analysis to better understand the nature and dynamics of the selected area, including developing a sanitation and hygiene profile, questioning what changes are needed, and assessing what the feasible options are along the sanitation chain. Also, what future plans cities or towns may have. There's stakeholder analysis, which involves mapping stakeholders and institutions and starting to build relevant partnerships. Selection of communities and capacity development, preparing to enter communities, which is involving and engaging local leadership and or other community groups. And relevant tools in this phase are things like baseline surveys, scenario planning, Venn diagram mapping, social network mapping, and statistical economy analysis. The second stage is the triggering and involves community triggering, institutional advocacy, and action planning at both the community and institutional levels. One important purpose of the previous assessment and preparation phase is to help design any subsequent activities. For example, if you find out that the problems are flying toilets or the indiscriminate dumping of fecal sludge, you can design your triggering tools around that. This photo shows open defecation in Lalibela, which is a relatively small town in Ethiopia, which is found next to a disused public lavatory. I put this photo up to show that it may not be the infrastructure, it may not be the fact that the infrastructure is not there, but that it's underutilized, or in this case, unusable for whatever reason. So in this phase, we have community triggering, which taps into disgust, frustration, and even anger people feel, and can ignite them to take action, and can be based on different failures across the sanitation chain. For example, water contamination results have been used to persuade people to upgrade from unimproved to improved facilities in Zambia. And in Indonesia, triggering was based around dangerous FSM practices. It also involves action planning, which includes communities taking actions themselves as well as engaging with wider stakeholders to ensure that they take actions that locals cannot do alone. And then there's institutional advocacy and action planning, and the aim here is to motivate a response and commitment from relevant institutional stakeholders. This could include municipal government, service providers, or landlords. So the third stage is integrating urban CLTS across the sanitation chain and focuses on the different actions by a range of different actors across the sanitation chain that are needed and ways that these can emphasize supporting empowerment and innovation, achieving collective behavior change, and a focus on universal access. It's about tools, tactics, ideas, and thinking on how to increase community participation and action in decision-making processes across the sanitation chain. This is demonstrated by the diagram, which I hope you can see on your screen. The blue boxes shows what Pippa was mentioned at the different stages of the sanitation chain. Below are direct actions can be taken by or within the community, and above are actions that require other stakeholders. However, we have an arrow of influence on the left, which is there to stress that even though they may not have direct control, community participation in decision making is important, and there is potential to influence decision making. So, moving on to the final stage, which is maintaining momentum. About building capacity and supporting natural leaders and community-based organizations to conduct follow-up activities and maintain and monitor progress. Establishing clear and attainable sanitation goals to be verified and celebrated. And these should be phased over a period of time. And tools and tactics here include things such as community exchange visits to review and encourage progress, community scorecards and inter-community monitoring, and celebrating key stages along the way to a shit-free environment. So just to finish, as Esther mentioned at the beginning, in response to calls from practitioners for guidance on urban CLTS, we're currently working on a document by those who wish to explore the type of approach, and it should be available in May or June next year. And if you have any questions after, we're welcome to ask them now, but if you want to send me an email, I'd happily.
Sure. Thank you very much for that, Jamie. So if anyone wants to put their hand up, but in the meantime, I'm just going to ask a couple of questions that have come up in the chat box. So the first of which is from Sarah, which she asked what's meant by empowerment. So what happens when there are different capacities among different groups? For example, lack of information and certain people not having a voice, which I think is something we've all come across in many different ways. So it would be interesting to get your thoughts on that.
I mean, it's difficult to say on a meta level what that means, and it's very dependent on conditions on the ground. What we're trying to say by empowerment is give substantial amounts of people in that community a voice and contribute to the process rather than empowerment of particular. I mean, we have looked at empowerment of particular parts within that community as well, but on the meta level, I suppose, it's about bringing the community voice to the table.
Okay, great, thank you. Pippa has raised her hand. Would you like to speak, Pippa?
Hi, thanks, Jamie. So I put a comment in the chat box, and it was just to kind of make this point around what we mean by community, and I fully agree with Jamie's kind of approach to it, that the urban community and the triggering needs to happen both kind of at the people kind of resident level, but also in the urban sanitation community there are MTers, there are institutions, there's there's a whole range of kind of other people where triggering also needs to happen. I guess my question, and it's also for on the clues point, is why are we using this term community? Is it kind of almost like in terms of that we want to demonstrate a nod that we are giving voice to people? Is it that adoption of kind of the need to recognize the input of the community? And is it the right term for us to be using? Because in the urban setting, communities are very complex, and I just wonder if it's the right term.
I think that's a really good question. Jamie, do you want to tackle it?
My initial reaction is yes, I think it's a term which I think we perhaps need to articulate better, because as you say, there is a community which is interested in creating a better sanitation environment, which will involve a range of different stakeholders, and there is the community who live in a particular area, and within that community there's also lots of different separate communities. But I think if we're able to articulate what we mean when we use that term, it becomes useful. But you're right, at the moment, unless we're able to do that, it means so many different things to different people. Well, not so many things different, it means one or two or three or four different things to different people.
Mm-hmm. But I think in the sector that's it happens a lot. I mean, I remember for my dissertation having to define sustainability, and it took up half of my literature review because it's such a big word that we throw around so easily. And I think the same is for, we've got an event next week on inclusion, which I know Jamie's going to be at, and it's the same thing, defining a big word like inclusion, community, sustainability. And I just wonder if we use community as a quick fix word, that if we throw that, buzzword bingo, if we throw the word community in, more people will look at it. Because in the chat box, Joseph's also made the point that it's not just triggering communities, it's triggering utilities and municipalities. And often when we get to the point of looking for a tool, we've already triggered them in some sense, because they're actively looking for some way of engaging the community. So they're already heading down the right path. But it is quite a similar point. Sorry, Jonathan has also raised his hand. So, Jonathan, did you mean to raise your hand? I can't hear you. Let me just, there you go, your mic's on now. Still can't hear you though. Do you want to type in a question quickly or try a different way? In the meantime, Sam has asked, what's SBCC?
I think that's in response to a question.
Oh, yes. Social
yes,
behavioural change.
Just asking, this Faye, maybe he could... Ah, there it is. Okay.
I see. Okay, Jonathan was going to say that the community-led approach is going to be more amenable in some political contexts. That's a good point, that community is a nice political friendly word. Okay, thank you very much, Jamie, and I definitely think you got one of the hardest questions out there. We're going to move on to Martha's presentation now, who during her PhD actually compared sanitation safety planning with clues as planning tools, and she's going to focus a bit more on the, let me just wait for it to load, on comparing tools, choice and comparison. And then we'll take some questions from Martha afterwards, and then maybe see what other discussion we can get going around this community engagement, which has quite a lot of potential for interesting points. So, Martha, over to you. Now you're
okay.
Yes,
no, I am on. Okay, thanks very much. I will talk a little bit about a part of my PhD research that was focused on the improvement of the sanitation system in peri-urban areas in low-income countries. And so I studied and analyzed different planning tools and in order to to do this. So the first observation I would like to share with you is that the best sanitation planning tool does not exist, in the sense that different planning tools have different characteristics and different strengths and also limits. So we will need to choose to select the one or the ones which better fits our objectives. So from the definition itself of planning, planning it is a process to develop a strategy to achieve desired objectives, to solve problems and to facilitate action. So at first we will need to see which is the objectives of our planning process. Another important observation I would share is that in complex contexts where we usually operate, a combination of different planning tools could be useful in order to obtain a better planning at the end. So the most important point, in my personal opinion, is not if the planning tool is the best one, is the perfect one, but is the planning process itself, which supports the creation of a vision within the team who is undertaking this process. So in order to choose which planning tool or which approaches to use, first is important, as I said before, to identify our scope, our objectives. So what or why we are planning for, which results we will expect, in which phase of the development of the sanitation system development we are. And then to find which are the criteria we are interested in. As an example, which are project objectives that can be different from the planning process objectives. In which context we operate is urban, rural, at which scale, regional, villages, neighborhoods, which are the skills available. So do we have a skilled facilitator? Do we know some of the planning tools already available? Do we have time or do we have money in order to learn about a new planning tool, or to employ someone which has the skills, the capability to implement a particular tool or approach? So which level of engagement or participation we would expect? We were before talking about community engagement. So which are our expectations in this sense, in this direction? Then the complexity of the planning approach. Is it complex? Is it easy to use? Which is the language in which it is presented, or the documents are written, as an example? Is the approach detailed? Is it a step-by-step guidelines? Is it was already used by others, as an example? It presents examples, case studies. Can we refer to previous experiences in other countries, similar contexts, etc.? So the time, which is the time we have for carrying out this process, do we have some important deadlines? Which are the costs involved? This is really important to consider. For example, do we need to carry out, I don't know, laboratory analysis, or do we need to employ someone, so human resources? Do we need fuel because we need to move around? Do we need money for allowances in order to let people or leaders to participate to our meetings or focus group, etc.? And finally, another criteria could be, as an example, if we are in a phase in which we are writing a project, so maybe an approach more than one other is more likely to be founded because it's well established, or because it's new, so it needs to be tested, etc. These are just some examples. Then on the basis of those criteria we can select for our specific case, together with our planning team, we can compare different tools, so we need to know, to have a list of available commonly used tools, and then to decide together with our team or stakeholder which ones we would like to implement. As I told before, sometimes in different areas in the same town, for as an example, we can need different approaches or different tools. So I will briefly present a case study in the town of Iringa in Tanzania, where I worked for my PhD research. Here we were collaborating within a wider project financed by the European Union and implemented by an Italian NGO, which was focused on the improvement of health and hygiene conditions of poor communities living in the peri-urban areas of Iringa municipality, with great attention to environmental, social and economic sustainability of implemented solutions. So those were the objectives of the project. So at first, we have a review of available and existent sanitation planning approaches. We built a table. This is an extract, an example. So we investigate about Sanitation 21, World Sanitation Approach, the QS approach, sanitation safety planning, etc., to see which is the aim of this tool, which level of participation required, which are sustainability criteria addressed, the typology, if they are step-by-step guidelines, etc. Then in a second moment we set up the criteria on the basis of which we choose the approaches to test within this process. So at first we wanted a step-by-step approach because we considered it easier to use for us. Then we considered the project staff experiences, so we have some local staff experiencing the use of sanitation planning approaches. Then we wanted something already tested, used in other developing countries in order to compare it. And then we wanted someone meeting the project criteria, as an example, health environment protection, creation of a sanitation business, promotion of resource reuse and recovery, and so on. What we observed was that any existent approach was meeting all those criteria together, but there was different planning approaches that was addressing some or more than one of our criteria. So we decided to test 4 of them. They were the QS approach, the sanitation safety planning, the human center and design, the sanitation marketing. So we applied in the field those approaches, then we evaluated their strengths and weaknesses and their limitation in order to understand how to integrate them on the basis of a desk review and also of their practical application in the case study. So we examined the sustainability criteria, the stakeholder participation, the required level of skills, the scale, the time, expenses, etc. This table represents some of the results of strengths and weaknesses of those 4 approaches tested. And what we observed as an example was that the QS was the strongest participatory approach, but it was lacking, as an example in our case study, to meet the criteria of health protection, recovery and reuse, etc., that were on the other side addressed by the sanitation safety planning. At the same, the creation of a business that was needed in the project was mostly addressed by the sanitation marketing with the support of the human-centered design that we applied in order to develop a product in the sense of toilets, low-cost latrines for households. So from this comparison, we elaborated this schema for our case study, in which it's foreseen the integrated use of those four planning approaches. In particular, in the first step of the sanitation process, the planning process, that is the problem identification and the assessment of the current situation, we will foresee the use of all these approaches, in the sense that we need to collect all data that permit us to create a baseline and to understand the context. Then the core of the sanitation planning process, that is the design and assessing of and the selection of option, is more addressed by the use of CLUES and SSP, while SM and ACD are mostly used in the implementation of action, in the sense that when plans are developed, at the end we can come again with the use of sanitation marketing, human-centered and design, in order really to put in practice those action we have established before. So in conclusion, this was just to show how different planning approach could be useful to be used in a single project, and it is important to know them before, and also to planning the use of planning tools in order to best optimize efforts in the terms also of time and the human resources and cost for carrying out this process. Thanks.
Thank you very much for that, Marta. I think it's quite useful to have that, having spoken about tools and where we are, kind of brings the reality into it and the actual processes we need to go through. There's a little bit of discussion going on in the chat box about how to get planning to involve the wider system, so not just sanitation, but other basic services such as solid waste management, drainage, those kind of things. But the whole planning process and decisions, to me, it's beginning to sound a bit like a vicious cycle. Where do we start? Because if we need capacity at a national level to be able to analyze and assess which tools to use, how do we get that capacity into the national level? If we need to ensure that we're involving all the different elements across the board, it just starts getting a little bit, personally I start seeing it as messy. But what I really like about what you've done, Marta, is the tools. Is there like a spreadsheet? I love a spreadsheet. Is there a spreadsheet for comparing tools? Like there is now in the FSM world, you get spreadsheets for helping you work out cost-benefit analysis and how to develop your system so it's financially sustainable. Is there something similar that has all the different tools so that you can just input what you're looking for and to a certain extent help you whittle it down?
Yes, for sure, this approach could be extended also to other services like water, solid waste collection, etc. In my case, I focus on sanitation, but I think that the approach could be the same with other services. Then, of course, it's concerning the point raised about capacity and skills, I think it's really important to spend a little bit of time in knowing, in trying to see which are available tools in the field we are working, for example, in this case in sanitation, and try to understand a little bit their characteristics, and also trying to understand which capability our organization or the authorities who we are working with or we want to work with have, and if these capabilities are not present, how to improve them, in the sense we can have trainings, we can have yes, capacity building also about the use of planning approaches. We have just to reflect about how time it will require and or cost, for example, of the training, etc. But I think it's something important to do, to consider. And then, sorry, I don't remember the last question.
Not sure I do. I was having a little bit of a waffle. Looking at, Arno's asked about the monitoring and evaluation. It's mentioned at the end, but do you have the list of parameters that you were looking at?
Yes. We considered this, we considered sustainability criteria, the stakeholder participation within each of the tested approaches, the required level of skills, also if we reach the needed level of skills in order to carry out these approaches, and the time and expenses needed, the complexity of the tool, and the adherence with project objectives that we set as criteria at the beginning. So we verified also this. These are aspects we choose together with the team to evaluate in our case study.
Okay, thank you. Would anybody like to ask a question? Please feel free to raise your hand or type into the chat box. I think building on what you were saying about capacity development, with your experience of doing this in country, did you find that there were people you were working with who were wanting to learn from you about how to continue this in the long term, or did you find that they were getting you to do something that they wanted to do but didn't necessarily have the capacity, and once you'd done it they were happy to walk away?
About this, there was in general, in local NGOs in Tanzania, I find really a lot of interest in learning about those planning approaches and also capabilities on the use of them or knowledge about this. There was also a lot of interest from the utilities, in particular the Sanitation and Water Authority of Iringa. Even if in that side we find difficulties in train, there was interest, but capabilities. Yes, there was the interest, but the level of capability was quite low compared to the time at our disposition and the complexity of issues we would like to share with them. And so this was quite a challenge, is to transmit also the competencies in order to use those tools.
Building on from that, Jonathan actually had a similar question, but do we have sufficient understanding of the incentives and the ways to motivate stakeholders to be engaged in the process, which you've kind of touched on, but do you think there's a particular set of motivation or an approach to that we could develop?
In our case, I think that to be involved in the process and then to see results, as an example, action plans, first results, etc., was a strong point for motivated also the stakeholder. Of course, it is like an iterative process. I mean, in the meanwhile, we were carrying out this one. of course, people that were involved felt themselves more also motivated. But I have no suggestion on how to motivate those people before starting the process.
Sure. Jamie, how about your experiences with U-CLTS on this?
Can you repeat the question?
Looking at motivating and incentivizing, let me just find my notes. Motivating and incentivizing stakeholders to be more engaged in the planning process.
We see experiences, different experiences, dependent on context and then dependent on the type of stakeholder. So there's been examples of creating landlord forums to try and get buy-in from landlords with these processes. There's also something which some people call institutional triggering, which is kind of presenting facts about what's going on at the community level to municipalities and then bringing them to communities and maybe getting them to come and witness some of the triggerings to get their stakeholders, to get their involvement. So it's really kind of mixed and varied. It's hard to keep one overarching style.
What about you, Sam, with clues?
Yes, so triggering the community is something that is done in the first 2 steps, but I think that's what also has been discussed this afternoon, is that I think here a mix of different tools and methodologies probably can be the strongest option that you have. So I think CLTS, for example, is very strong when it comes to triggering communities, when it comes to creating demand. And then I would say that clues has a strength in the subsequent steps of assessment, in finding solutions together with the community. So I think here it's really about finding the right tool at the right moment for the right stakeholder, rather than following one approach and nothing else.
Yeah. Pippa, is there anything you've seen in kind of your more overreaching work around this about, because we're focusing very much on tools and incentivization, but is there kind of almost like a triggering, as we say, a process that it helps to go through?
Well, I tend to agree with what's been said, that I don't think there is, and I don't think there's any kind of argument here for a set process of one size fits all. It's about finding what works in the moment, and I think it's about understanding how these tools can kind of help for particular aspects of the problem. But there is no one size fits all. It's about understanding the limitations and the kind of attributes of each of these and helping to kind of plug them in.
I wonder if sometimes as well there's a wider reaching set of activities, like there's been some experimentation with some countries in using financial incentives, be this prize funds or interest-free loans and things like that, to trigger the input in the hardware, which then needs the community engagement. It's one of those that I think sometimes we just get so excited with carrying on down a route. We've got a program, we've got a plan, we know where we're going, that we forget to take this wider view. And even the operating in silos, the fact that we focus so much on the sanitation, and as Pippa's been raising in the chat box, the need to have the cross-sectoral approach to this, looking at how it integrates with drainage, how it integrates with solid waste management. And all of these tools kind of should get us thinking that way, but they don't always manage it. Not sure where my point's going though.
So I think one thing that the kind of the Sanitation 21 and the kind of the way that the conceptual framework, so the model that I presented right at the end of my presentation, was a conceptual framework of how we can think about the city, and that's at the core is the domestic and the peri-domestic domain, and that's when there's a lot of issues around demand are focused. And then around that you've got all these different service delivery networks, and that's encased by a much wider enabling environment. And I think maybe it's important to understand, as you say, which aspects, which tools we're kind of, which part of this problem we're trying to fix. Are we talking about institutions and enabling environment? Are we talking about kind of understanding demand at the nub, at the kind of community household level? How are we understanding the city, and at which point are we targeting? I think there can be multiple ways and processes of how we go through it. I don't think that there's a natural start and end stop. I would argue that a strong utility and a reasonably strong municipality is fundamental, or rather important, for things to kind of get going and off the ground. But there's multiple aspects around that as well.
And I think we can talk ourselves around in circles on it as well, because it's easy enough to do. Just on time check, we've got about 15 minutes left. I'm very happy to take some more questions. I'm also happy to invite questions from the presenters if they want to ask each other something. You can all just stick your hands up and I'll come to you, or type it in the chat box. Arno's just asked, what tools will work best in mega-sized slum communities? Wow, you don't give an easy scenario, do you, Arno? Would anybody like to particularly take this one? Don't all jump in at once. Jamie?
I mean, from our perspective, we'd say that there is something urban CLTS can contribute to in that situation, but it would need to be integrated into a much larger program. So there are parts of it which could be used, but it would be a small component of a much larger puzzle, which isn't particularly helpful.
Sounds like the most diplomatic answer I've ever heard. Sam, you've put your hand up. Do you want to say something?
Yes, let me be less diplomatic then. I think it might be the wrong question to ask in the first place, because I don't think there's, or back to the word community, I don't think that there is the mega-sized slum community. So you rather have to start, okay, what is the actual case that you work on, and then try to find the tool or the approach that fits that specific community, that fits that specific context or the specific challenge that you face there. So I don't think that there is the tool for the task, but rather you have to pair it up every time.
I think, yeah, and also it's always changing. The thing with slums is there's never any consistency, because the size grows and the situation changes. Pippa or Martha, do you want to add anything on that?
Okay. Yes, I agree with Sam in the sense that I don't have any answer to this question in particular, but it depends really from the context and from other things we would like to take in consideration in order to select the best tool for this case. But I think CLTS could be a good starting point.
Okay. Arno, I hope you got some kind of answer to your question.
Yeah, no, I did. I really think this it's highly contextual, and I think sanitation suffers from the fact that it often is not integrated into a broader development type of situation. It's brought in unilaterally, not dealing with drainage or roofing or communications or anything like that. So WASH suffers maybe from that point of view. But there is no specific triggering for such, when you have 1 million people.
Sure. I'm going to ask, there are a couple of people typing, but having seen the attendance list for this previously, there are quite a few people who are working on new technologies, and by new technologies, I don't mean anything crazy, but stuff that isn't part of the standard sanitation arsenal. And I just wonder about what are the kind of points to consider maybe for community engagement when we're looking at relatively untested technologies, because increasingly the standard solutions aren't working. We do need to think outside the box. So do you think that these tools are very much framed around the standard options, or do you think they can be made flexible for when we're thinking much more, I hesitate using the word alternative, but different approaches? I don't know. Does anybody have anything to say on that one? I wonder if it fits in with Pippa's view of urban sanitation and where we're going for the future.
I have a question. What technologies are we talking about?
I guess I'm thinking about the crazy stuff, like what Gates is up to. The thinking very far outside the box. The increased use of maybe reed beds in an urban situation, or which isn't a new technology but possibly a new scenario. And I guess Alan's also kind of raised it, the emergency settings. The less, that possibly is on another tack altogether, but the less conventional, we're not looking at pits, we're not looking at possibly municipal provided services, how we can get the services of these new technologies. Does that help?
No, it does. Just to kind of get a feel, and I think that again it comes down to understanding who are the stakeholders in the urban sanitation setting and in the urban development setting, and if they are private, small-scale providers who maybe are off the kind of conventional radar, let's say, but they are active and working in that setting, that it's about understanding where they interface, where they might interface with the community, with their customers, with whatever that relationship is, and where they might interface with the bigger parts of the city. So if that is that they require land, if that is that they require kind of permits for operating, how do they sit within the city in terms of a service provider? And I think there are ways of bringing them in, and there are ways of planning with them, but it's about understanding where they sit and how they interface.
Yeah, thank you, Selma. The Tiger toilets is one, and as soon as you said it, it led to me thinking of the Earth Auger and the biofill toilets as well, which I think the jury's still out on those. They're a bit more off the wall. Jamie, Marta, do you have, Sam, any thoughts on that one?
Just the fact that one of the benefits of these community-based, community-led approaches is that you have the option to explore some of these with communities, because at the end of the day we kind of want technologies which are going to be used and appreciated by the communities we're trying to serve. And so if you're able to engage the user of the technology in these conversations, from my perspective, that's got to be a good thing.
Yeah.
And just one other point on the, if you are kind of connecting with the community, that that enables you to connect with people who are often invisible from the kind of top-down service provider, kind of official service provider approach. So tenants, people living in informal settlements, people kind of essentially invisible. That if you're working then from this community point, that you can kind of provide, Arno put something in about container-based solutions. There are technologies that are essentially much more better suited to people with informal or insecure tenure, and those solutions can meet their needs much better in terms of providing sanitation services and not necessarily being fixed infrastructure that they don't want to invest in because they don't have tenure security.
And I wonder slightly if this goes back to what we were discussing earlier about the politicalization of these tools, that I know with container-based, often politically it's not seen as a improved sanitation approach. And I wonder with these, if sometimes that's actually what it is, that if a tool, and I don't know, Marta, if your experience is anything like this, but if you're using a tool at with a municipality or local government, and it's got to fulfill to a certain extent their expectation of what sanitation direction you need to go, whether or not there is room for this community engagement beyond the direction they're already trying to go down. It's that classic thing of you write a proposal saying that you'll do some research to decide which direction to go, when actually you already know which direction to go, because otherwise you can't get the funding. And I do wonder if sometimes the tool, and this may be what Jonathan's trying to get at a bit more, that the tool is actually just a process we're going through, and we're not doing it for the right reasons. We're doing it to tick a box. And it goes back to incentivization, I guess, really, doesn't it? How do we incentivize using a tool in the right way for the right thing, rather than pre-deciding what the solution might be? Yes. Sorry, Martha, do you have any thoughts on that one?
No. I find the microphone. Yeah. No, yes, I agree with your observation, in the sense that I consider them, as I tried to explain before, that it's really, I consider the most of existent planning approaches really valid. I mean, they have strength limits, everything, but they are valid in themselves. So the real point is how to use them, or to which extent to use them, or to adapt them to our objectives, to our context, to what we need to do. And also, if we need to strongly involve, for example, the municipality, etc., there are many of those tools, those approaches, sorry, that give us tools in order to empower also the institution, or step-by-step indication of how maybe to get them more involved or more interested in this approach. And also concerning the different options, I think that there are so many options at the level of sanitation that the tool could really support us in order to choose the best one. In our case, the human-centered design was really useful in order to both motivate and both understand the expectation, in particular of communities, because we applied them, this tool, in the community. And so I think this one could be really useful in order to involve the people, but also to permit the planner, the decision maker, to listen and to understand what people really want.
Okay, thank you. Jonathan?
So I was just reflecting on a couple of points. First one being just thinking about how we can relay some of this discussion back to our colleagues in Zambia in some meaningful fashion that might help them with the issues that they raised. And I must admit I haven't got any clear answer to that one. The other one was just I think Esther, you've mentioned this sort of this circular process, and this seems to be coming up again, which is the fact that the tools or the approach is a means to an end, and it, from the stakeholders' perspective, it's the end that is of relevance to them, and too much focus on the process or the tools or the approach isn't really what they're interested in. So it does come back to the point, I believe, that folk thinking about the incentives, and this was a bit of a light bulb moment that I had, which came to me when Pippa was making her presentation that she gave at the beginning of this webinar at the WEDEC conference, and I really sort of made me think, do we really understand the incentive mechanisms enough? That's a point I've raised earlier. We have certain understanding or approach to triggering behavioural change, and we have market-based approaches or sanitation marketing. We have the one approach, I don't know if there are more, but there is the approach of the economics of sanitation as a mechanism to incentivize and trigger political behavioural change. And I was just sort of thinking that how can we embrace that and then come up with a more of a collective approach which incentivizes a range of stakeholders as part of that community within these urban environments where we want to initiate change, rather than just having one sort of singular approach which would focus on one type of stakeholder. That was a comment, really. Long
Quite
comment.
big. And almost lends itself to another webinar discussion, kind of actually quite nicely. What can we learn from all those different incentive mechanisms? Wow, that's a huge comment. Would anybody like to say anything on that one? Excellent. Thank you, Jonathan. We've actually reached our time. I just want to say, Alan, I have seen your question about U-CLTS being used in the Middle East and emergency settings. I'm going to get in contact with Jamie about that and see if he's got anything he could share on that with you. Otherwise, I think we're going to leave it there. I would like to say thank you very much to our speakers for really interesting aspects to community engagement, and even having heard some of them before, I actually still am learning a lot from each one of them. I'm not a community engagement specialist, but I do think that the more awareness we have around these elements, the easier it is when we are working on technology and more techie-based things to actually be aware of how we should be engaging. I think the key point from today's discussion is exactly that it's very circular, and that there is this big question around incentivization that maybe we should come back to at some point. And if anybody would like to do something on that, please get in touch with me. I'm quite happy to help set it up, because I think it would be very worthwhile. Otherwise, the recording of this will be available in the discussion thread. Feel free to put any questions, comments, or feedback for the presenters there. I'll upload the presentations there, because I know a few of you were asking about that. And thank you for your time.
Thanks, Esther. Bye.
Thanks, Pippa. Bye.
Bye-bye.
Bye.